Hi everyone, this is your petite INFJ doctor and welcome to Alice in Medical Land. Today, I'm going to share how I passed PLAB 2 in one shot. First and foremost, after receiving your PLAB 1 result, please give yourself enough time to rest and reward yourself so that you can feel refreshed after that and you'll be ready to prepare your PLAB 2. After that, I would really recommend you joining an academy, whichever it is. I know some of the most popular ones like Aspire, Moshobi, Common Stations. For me personally, I joined Common Stations. Part of the reason is because I wanted to live with my brother who was living in London at that time. So I think Common Stations would suit me better. And the other reason would be because whichever academy you choose, the most important thing that you need to do is to practice, and practice. Okay, so the purpose of this video is not to promote any academies, but I'm just sharing my personal experience going through PLAB 2 and how I prepared for my PLAB 2. So if there's any brand that I've mentioned, it's nothing to promote them at all, and please take it with a grain of salt. Next, I'm going to talk about the next step, which is practice, basically. As you may all know, PLAB 2 is an OSCE exam containing of 16 stations plus 2 rest stations. In each station, you are given 8 minutes to prepare yourself, to talk to the patients, and basically do whatever they want you to do there. So please practice with the timer of 6 to 7 minutes instead of 8 minutes, because most of the time the problem is in the time management. You don't really want to actually spend the whole 8 minutes just to do history taking. You need to time yourself ending the station in 6 to 7 minutes, ideally. Next, don't forget, when you want to enter the room, you still need to introduce yourself and state your GMC reference number. So that also counts to approximately 10 to 15 seconds of your time. So it's also another thing to be considered as well. Next, regarding the stations, there are various stations that are going to be tested in PLAB 2. The first and most common one would be the history taking stations, where you are given a task to talk to the patient, do a history taking and appropriate physical examinations, try to come into a diagnosis, disclose the diagnosis, and plans management further. And don't forget to actually give warning signs to the patients when should they come back to you or reach medical attention immediately. Okay, that's for the history taking stations. And there are also counseling stations where you might be given the task to actually talk to the patient how to take their drugs, or you're telling them like the result of the bloods or investigations or further investigations required. Those falls into this second category of stations, which is counseling. Apart from that, there's also teaching stations. I understand that this might be like a foreign idea to many of the IMGs, because we are not usually asked to teach or asked to perform how to teach a medical student. But this is one of the most common stations in PLAB 2, so you need to prepare that as well. Teaching stations could involve you teaching a medical student or a patient or their relatives. For example, how to use an EpiPen, how to read an ECG, how to do BLS, and stuff like that. And please prepare about that as well, and don't underestimate this kind of stations, because this station could give you marks actually. Next would be CMEN. CMEN is actually a simulation station where you're being placed in an usually acute situation. In that station, you need to approach the station by using ABCDE approach or primary survey, and you are not actually talking to a patient, a living human directly, but to a mannequin. However, the mannequin is very smart. You can basically get most of the physical signs that you want to get from the mannequin, like for example myosis pupils. You can also check their pulse, and sometimes if the patient is supposed to be conscious, you can see and hear that there are someone else talking to you, acting like the patient, but you still need to pretend that the mannequin is the patient themselves. That's for the semen. The other station would be prescription station, where you are given a task to actually prescribe anything using a paper prescription. And please prepare that there are 2 settings possible: inpatient and also outpatient. Outpatient might probably be in the GP setting, where you have to use your FP10 form, prescription form, whereas the inpatient is actually an inpatient prescription charts. Please prepare, because you are expected to actually open your BNF book and cross-check your prescription, whether you are being a safe doctor, like whether you're prescribing it with the right dose, and also you are aware of the drug interaction, and possibly adjust the prescription if there is drug interactions. The last bit would be ethical stations. Ethical stations will mostly involve you being placed in a difficult situation, and you need to actually talk in those situations. For example, dealing with difficult colleagues. For example, a colleague who appears to work late, or like colleague who appears to work drunk, medical student being late in the ward, how you're going to talk to them, and breaking bad news, disclosing cancer diagnosis, and even patient complaint could fall to this category. So please prepare these stations really well, okay? And apart from the academy, I took additional classes. I took Dr. Loven's master class and also Dr. AZT prescription class, just to supplement myself with different ideas of what I studied in the other academies. So it might worth to take a look at that as well. Besides reading through the academy's notes, I also cross-check every scenarios with the current guidelines, using the NICE guideline and also Oxford Handbook of Clinical Medicine, or Oxford Handbook of each specialty. And I found reading Oxford Handbook of General Practice is quite helpful for me, because I could actually see like their criteria for referring patients from primary healthcare to the secondary or tertiary one, and how long the patients should be seen by the specialties. So I recommend you reading that as well. And don't forget about BNF and BNFC for pediatrics in prescription stations. And for ethical stations, it might be difficult for us to know like what are the expectations that GMC want from us. But luckily, GMC is quite strict about this and quite resourceful. There is GMC Good Medical Practice, and please make sure you're reading the most updated one. I think they just published a new one early this year, 2024. Please familiarize yourself with what they expect you to do from a doctor. If you have read that, I'm sure dealing with ethical stations would be easier. Next, 2 months prior to your exam, please make sure that you access PLAB forum in this course website, because I find it really useful. It describes, recalls each day, and please familiarize yourself with each scenario that was out in the recalls, because most probably your exam scenarios would be similar to the ones in the recalls. So please give time for recalls as well. Okay, next I'm going to talk about mocks. I believe attending mocks is important because we can actually test and evaluate ourselves being put under pressure, 18 stations non-stop. I'm sure while we are practicing, handling one station, each of us in turns, is bearable, but actually having 18 stations non-stop is quite a challenge. So having mocks is quite important for me. Apart from having mocks from my academy, I also attended mocks from another academy as well to just evaluate myself using a different perspective in a way. So you may want to consider that as well. And last but not least, PLAB 2 is an OSCE. So it is actually a test of your communication skills as well and your English fluency. So please don't forget, even though the patient is not a patient, it's not real patient, they are actually simulators, actors and actresses, good actors and actresses. Please still act like you're talking to the patient. Don't lose confidence while talking with them. Just empathize, being professional, be confident, and speak good English. And don't even scared to actually ask them to repeat what they were saying if you couldn't catch their accents. They are very cool about it. Just ask, like, could you try to speak slower? If that's possible. Could you repeat that again? Sorry, I didn't quite hear it. I didn't quite catch it. Feel free to say that. And in my exam, I think I had quite poor vocabulary in terms of like the occupations. So actually the patient told me something that I didn't know, like what his job was. So I just clarified with, I'm so sorry, would you mind telling me what you do in that job? He open-mindedly told me that he needed to climb like tall buildings. Oh, okay. So I immediately know that it's actually a dangerous, high-risk job. So if I didn't clarify the name of the job in the first place, I would miss that. So be confident. If you don't know what the patients were saying, just clarify again. If you didn't really catch the accent, just ask whether they could actually repeat that again. And be confident, empathize, and practice. Okay, I think this is it from me for today. I hope my tips and tricks in dealing with PLAB 2 in one shot would be helpful for you guys. Please show support to this channel by liking, sharing, and subscribing to this channel. And this is it from Alice in Medical Land.